Do you have a low threshold to pain? I often have patients coming along and telling me that their pain threshold has been lowered, or that they have a high pain threshold and that they can take pain much more before they need medication. And that means that they are in the clinic because their excessive or high pain threshold has been breached, or that their pain threshold has been lowered. But what do we mean by all of that? Effectively, now there is some more science to actually look at this concept of threshold. While the threshold itself indicates a subjective component, so different people having different thresholds there, we are now realizing that there is probably a biochemical or a physiological way of looking at threshold. And that effectively comes down to what's called sensitization. What we are now saying is that the nervous system is constantly on the lookout to protect us. It's taking in signals from all parts of the body. It can be an external stimulus, which can be an injury. It can be also an external input that comes through when you have a fracture, or when you have a flare-up of your rheumatoid arthritis or your osteoarthritis and your knees or your ankles get swollen. All of these are relatively external inputs because they come onto your skin. Sometimes these inputs can be ones that come from your eyes or your ears. So what you see, what you hear, what you feel, all of that can be inputs that come through external events. They would then go through the nervous system to your brain. You can have internal inputs. So these are often the inputs that come from your gut through your nervous system that's there in and around your intestine. And that is often taking information from the kind of food you eat. The various organisms that are in your gut, they would be combining or interacting with the various molecules in the food, and that would be sensitizing the nervous system in your gut. So that's the internal input. And all of these inputs are being sent to the brain, and the brain's having to make sense of all these inputs and saying, this is the amount of protection I need to do, and therefore it would bring about the experience of pain. If you think about it in this broader way of external and input events from internal as well, you can see that sensitivity of the nervous system, how much it would respond to bring about protection, will also depend on all these inputs as well. So you may have a surgery related or a flare-up of your arthritis related event, but at the same time, if externally you're in a situation where you're feeling threatened already, or you're having stress, or you've not had enough sleep, or you are running late and there is some pressure, all of these are going to be further inputs in addition to your arthritis flare-up or a injury, and all of that is going to be perceived by the brain as an increased amount of sensitivity coming through. And that could mean that your threshold for feeling the protective experience of pain is lowered. So you can have a low threshold to pain when you have other factors affecting the input. And conversely, you can have a high threshold wherein if all the other factors are fairly stable, an injury that you have because of a fracture or fall or any surgery or even a flare-up of your arthritis, that particular event would not be that painful because there are other factors that are providing an input to the nervous system, so it doesn't have to fire off that easily. So that can be a high threshold. We are now starting to recognize and say that sensitization is often a reflection of the threshold to pain that we talk about. So, do you have a low threshold or do you have a high threshold? The reality is that it often can change. It can change upon the context. It can change depending on the time of the day. It can change depending on nutrition. It can change depending on the physical or sedentary nature of the last few days of your life. It can change depending on other psychosocial or stressor or employment or family related factors. It's not a constant, it's something that's changing based on the person and the context, and hopefully that chimes with you and your experience of threshold to pain. I hope you found this video useful. I'll see you in the next one. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.